What's your name?
Phoenix.
What's your whole name?
Phoenix Woodard.
How old are you?
11.
Where do you go to school?
Whittier.
Where's that?
It's in Southside Scranton.
Do you like it?
Yeah.
You actually like school?
Yeah. Because I get to hang out with my friends and we have our own basketball team.
Are you guys good?
Yeah, kind of.
What do you mean, kind of?
We lost a lot of games, but then we won a lot of games too.
My name is Micah Woodard. I was born right outside of Nashville, Tennessee, small town called Springfield. Lived my earliest years there. When I was 9, I moved to England with my family.
My name is Lauren Woodard. I grew up in Point Pleasant, New Jersey. My childhood was like every other person's childhood, pretty normal and average.
We were a very close family growing up. Cousins, the whole family got together every Sunday for lunch, really close. Just came back for college, that's it. And so I played soccer, and I was in the Harrisburg area and doing an internship, and one of the guys there knew of a school in the Scranton area, and I came up and visited. I met with the soccer coach and ended up going to school there.
We met at college. I had transferred in, and he saw me around campus and decided that he wanted to ask me out.
Sometimes in life you see something or something happens and you just know this is it, this is happening. I saw her from across the room and I thought, you know what, I don't care if I have to leave school, I don't care what I need to do, this is happening.
He then started calling to figure out which dorm I was in because he wanted to get my phone number.
Just random numbers in the girls' dorms to find out who this girl was, didn't know her name, nothing.
So he ended up calling the girl who lived next to me. And so she comes into my room and is like, there's this guy on the phone who's asking if I know your number. And I said, this is Lauren. Can I help you? And he goes, well, I'm trying to get in touch with this girl that I've seen around campus. And I'm like, okay. And he's like, but I don't know if it's you because I don't know her name. And he's like, so I want to make sure that it's you.
And I was like, tell me, what you look like and make sure I'm talking to the right girl. She goes, well, you're the one who called me. So why don't you tell me who you are and then you say what you need to say. And, I turned into a big wuss. And it pretty much ended with her saying, well,
how about the next time you see the girl that you want to ask out, you go up and introduce yourself.
And I got off the phone and everybody was like, how did it go? I was like, well, she's a but I'm probably gonna marry that girl.
And that was our first interaction. From there, it became a little bit more normal and commonplace. I, at that point, had figured out who it was that had been on the phone and was kind of like, oh, thank God he's cute.
Here's the thing, I do a lot of dumb stuff, okay? I do. A lot of things I do don't go well. Yeah, it was gonna be the smoothest thing that ever happened. I was gonna hit on this girl, we're getting married, this is great, and I bombed. It was bad. It was bad. And she is very possibly the nicest person ever. She just lets it go. She's never once rubbed it in my face that I have absolutely no game. And here we are now, almost 12 years later. So that's how we met.
But it didn't take very long to know that he was the person I wanted to go through life with. But I'm a very precise, particular, organized person. I don't jump into things. But it wasn't a rushed decision at all. It was just an easy decision. I looked at him and immediately he's a good person, he's a good man, he's going to be a good father, a good husband.
We met February 2003. We were married in August of 2003.
When I found out that I was pregnant with Phoenix, the first decision to come into my head was, I want to have a family.
I love family. I want kids. I want dogs. The family I always wanted. That was always, for me, a dream.
I had a very easy pregnancy with him. It was scary. I feel like everything that we've done in our life has been scary and exciting.
Terrifying. I had just turned 21. Life skills, financially, everything, so not ready to have a kid. But just like everything else in life, when push comes to shove, you do it. You figure it out.
Seeing him for the first time was absolutely incredible. They laid him in like this clear bassinet right next to me. And I remember like rolling over and looking at him and just thinking, whoa, hello, little Micah. Like he looked just like him. And you know immediately, like my life is going to be different. My life is going to be a lot more complicated, but my life is just starting.
Your whole life, you have a plan for what it's going to be. You have a career plan, you have a family plan, you have goals. And then all of a sudden, you're holding your child and they have goals. You have goals for them. You have dreams for them. And your job as a parent is just don't mess it up.
We love being parents, and now we look at Phoenix, and he's not just our kid, but he's also what really solidified our relationship and brought us together permanently.
We have the best marriage I've ever seen. Our family's so close. All the things that should have torn us apart brought us together, so.
We found out that he was sick when he was about 3.5. We had seen symptoms, not knowing that they were symptoms, for a couple months. All of the symptoms were things that I could reason away. He had signs of what they now call precocious puberty. His body thought that it was time to go through puberty at 3 years old.
You know, he's starting to develop, at 3 years old, a little, peach fuzz on the lip and, sweating and getting little pimples on the forehead. And, at first it was just, I have a thick head of hair, Lauren's Greek. And then this is what happened. Phoenix is just, he got the Greek side in him. But, after a while you start to notice some things that became concerning. And our earliest thoughts, indicators, were that it had to be something hormonal.
At first, that's what his pediatrician started thinking when I told him what my concerns were. And he said a hormone imbalance in boys of his age is fairly common and easily treatable. But then once he examined him and looked at him, he immediately wanted to send him to have his pituitary gland looked at. And I took him to get his head scanned, and everything came back fine. And then they decided that they wanted to scan his abdomen to look at the adrenal gland.
And it took about a week for them to get all the information, I think about a week. I had to come back, I was working, so I had to come back for work. I was finishing up college at that time.
Our pediatrician then called us and said that the scan came back and that there was a mass. And he immediately sent us down to Children's Hospital of Philadelphia. We went down there that day, and they took us right in and told us that it was a tumor.
So when we initially got the news that his diagnosis was pretty bad, I heard that over the phone from Lauren.
They actually ended up admitting him immediately, not because of the tumor, but because the tumor had taken over his adrenal gland, and it's what they call a functioning tumor. So the tumor was still working as his adrenal gland. It was pumping levels of steroids and hormones into his body that a 3-year-old body can't handle. Because of that, it had raised his blood pressure so that he had adult hypertension. And it took about a week and a half for them to bring them down to normal. In the meantime, the oncologists came in and met with us. Based on the aggressiveness of the cancer, the location, and the fact that it was a functioning tumor, they were able to diagnose him pre-surgery with adrenocortical carcinoma. Adrenocortical carcinoma is an extremely rare cancer. It is rarer in children. It is rarer in boys. It is rarer in boys under 5, and it is rarer to be a functioning tumor, all of which was Phoenix. It actually only accounts for 0.002% of childhood cancer. So the tumor had actually eaten into his artery and was going up one of his arteries as well.
One of the things that's great about Children's Hospital is they don't give you the good scenario, bad scenario. They start with worst case scenario. This is the reality of the diagnosis. This is worst case scenario. We're hoping we can land somewhere north of that. So that initial diagnosis was, this is the type of cancer he has. This is what we know about it. People don't survive this type of cancer. It's a deadly cancer. The survival rate, I believe at that time, was around 10%.
Pre-surgery, they put him at like a 5 to 10% survival rate because he was in the 3rd stage. And I made the mistake immediately of Googling it, which you're not supposed to do, and saw that 3rd stage, the survival rate was like 5%.
Drove down to Philadelphia. Lauren and I got a hotel room, and we spent just a few minutes rehashing the conversation with the doctors. We just laid in bed and cried. And I don't know if it was intentional. I don't know if it just happened this way. I don't know. But it was almost like the next morning we both woke up, we got ready, and from that morning on, we were going to tackle it head on.
Pretty much the only treatment for his cancer at the time was surgery. You removed it and hoped you got it all and hoped it didn't come back.
We went to the hospital. We talked to the doctors. They really talked through what our options were as far as surgery, chemotherapy, talked us through all of the negative realities of chemotherapy, the type of chemotherapy you would have to take. Because of the way the tumor was in his body, it had started growing towards the heart, how dangerous surgery was, how dangerous the chemotherapy was. And we just made the decision that whatever it was, we were going to fight it.
The surgery for his tumor was one that not a lot of surgeons have had an opportunity to do because of how rare the cancer is. The surgeon that we had, Dr. Matei, he had done the surgery once before. So we were actually very fortunate to have somebody. He was absolutely amazing. He put it at an 8 to 10 hour surgery. It had the potential of being, because the tumor had eaten into his artery, they were predicting that they might have to do bypass as well. They had their surgical team in the operating room, but they also had a cardiac surgical team in the operating room just waiting to see if they'd be needed. We were in the waiting room and the surgeon came in, and after 3 hours, I didn't want to see him because I shouldn't have seen him for 8 to 10 hours. So when he walked in after 3 hours, I panicked. I immediately thought something had gone wrong. My heart dropped.
That 30-foot walk to that little room was terrifying because the reality in our minds was the surgery didn't go well. They either couldn't get it, they closed him up, and they just weren't able to remove the tumor. Something went wrong. He didn't make it through the surgery.
And we go into this room, and of course the room has 2 chairs and a box of tissues. That's it. And my heart is like beating out of my chest. And I think I'm gonna have horrible, horrible news.
You know, I think the looks on our face said it all, and he just said, I don't know what to tell you, but I'm really good at my job. I got it all.
And he goes, we went in, and we were able to just cut out the tumor. And then the first thing we tried was to clamp off the artery and just slide it out. And he's like, the whole thing slid right out. And we got everything.
And that was it. That was surgery day. They needed about 30 minutes to get him to a hospital room. We walked in and he was awake, he was groggy. Within 2 days, he was up running around and jumping around after major surgery. Just crazy.
They had someone come in and we signed off on his tumor. And part of his tumor was flown to St. Jude's for research, and part of his tumor was flown to another study out in Brazil. That's how rare the cancer is before the surgery was even completed, they were being contacted by different hospitals that wanted the tumor. So they gave him a couple weeks to recover, and then we went back and they explained to us what his treatment plan would be. We were down in Philly about 16 days out of every month. Part of it was done in the hospital, and he'd be in there a week at a time receiving the chemotherapy. And then the other part, the mitotane, was orally administered 4 times a day. The problem was that mitotane had never been given to a kid that age before, so it only came in pill form. So they had to train us on how to change this chemotherapy into a liquid for him 4 times a day. So in part of our kitchen, we would have to put on a mask, put on gloves, lay down a sterile sheet, and then we would have to grind up the pill, put it in a pre-measured amount of milk, heat it up in the microwave to dissolve it as best you can into the milk, and then we would try different flavorings for it, put it into an oral syringe, and then administer it. It was cakey and pasty and disgusting, and he hated it. We actually developed a hold that we would put him in. I would sit on the floor, pull him into my lap. I would wrap my legs over his legs to keep them from kicking, wrap my arm around his arms to keep him from thrashing around, and then hold his head and shoot the medicine into his mouth, and then hope he didn't throw it back up. And it sounds like a silly thing, like giving him his oral chemotherapy was so hard, but it was emotionally exhausting to have to like pin my kid down and give him something that he hated. And I mean, I'm putting him in almost a chokehold to do something good for him. But at the same time, it was hard to even explain how it was good because the only effects he saw were negative.
It was harder for us readjusting to normal life after coming off of chemo than it was going on to chemo. When it's done, there's empty space, there's empty time. All that time that would have been spent fighting, going down to Philadelphia, taking medication, and then that's when you have time to think. You start to think about everything you went through. You start to think about all of the what ifs, what could have happened. And that's when it gets really tough. That's when the emotion kicks in and the reality of the bullet you just dodged really starts to sink in.
I think we definitely needed to fall apart after treatment was over. We weren't the patient, we were the parents of the patient. And as the parents, to have to be strong, be calm, be happy. Even when he lost his hair, we were sitting on the couch. He was watching Bob the Builder, and I was rubbing his head, and all of a sudden I realized like I'm holding some of his hair. And I looked at Micah and motioned him over, and he came and sat down on the other side of Phoenix, and I showed it to him. And he just kind of smiled at me a little, and we just sat there and watched Bob the Builder. And I wanted to cry. I wanted to fall to pieces, but Phoenix was right there. So it just would have made his situation worse for us to fall apart. And we just had to sit there and watch Bob the Builder.
It's fight or flight. In the moment, you can't run from cancer. You have to fight it. You don't have a choice. So you just do. You have surgery, you start chemotherapy, you stay upbeat, you stay positive. That's the only thing that's going to get you through it. And then when all is said and done, that's when it really kicks in.
It's surreal to think back on. It feels like it's another person's story now.
We are who we are because of those early years dealing with cancer, having to be strong, having to take care of kids when we were exhausted. All of those things has made us who we are, has given us the family we have, the marriage we have, the life that we have.
Phoenix didn't pick up a basketball until he was, I think, 7 years old.
And I will never forget the day that Phoenix told me that he didn't like soccer anymore and he only wanted to play basketball.
Micah grew up over in England. He's soccer.
Devastating. Absolutely devastating.
He picked it up in like the end of the summer, and by October he was on 2 teams. Part of it is he's an athletic kid. Another part of it is, and we always say that this is his biggest strength, is he is a perfectionist. He is organized, he is disciplined. And I think part of that comes from his childhood being in hospitals. His life worked around medication times. He always had that structure. So for him, you tell him, well, you need to work on your free throws. Okay, he loves repetition. He'll stand out there and practice free throws until you tell him that's probably enough.
The thing that makes him a good basketball player, I think because of the developmental years in his life, being in the hospital, routine, discipline, he very quickly became talented.
And he looks back at his time in the hospital with nothing but a positive outlook, because they had child life specialists that would play with him. They had a music room where there was like this little red guitar that he loved. And it is honestly a huge testament to the hospital that a kid can go through that and be pestering us about when he gets to go back to the hospital.
He started going to Boys and Girls Club. They've gone to Boys and Girls Club for years. And one of the coaches there, Lloyd, he and Lloyd just connected. They put in a lot of work. And between the end of basketball season that year and then the start of basketball season the following year, Phoenix became a very good basketball player.
As far as where he is today, he has been off of treatment for 7 years. He will be moving into long-term care clinic. They will look more for the long-term side effects of the chemotherapy. Even Kylie and Phoenix, their relationship as siblings, you see how it affected them. And we're so glad that he had Kylie, because when she would come to the hospital to visit him, she's a 1-year-old. She has no clue what any of this stuff is. And she could make him laugh and make him get up and play like nobody else could. Her childhood was also shaped by his cancer. I remember her crawling in the hospital. I remember her then walking in the hospital. I remember her then running in the hospital. They talk about cancer as if it's the most commonplace thing. They're shocked that no other kids in their school have had cancer, because for them, it's just a part of their life.
One of the things that I love about Phoenix, and I guess probably is the best way to describe him, is he knows exactly who he is. He knows what he loves. He knows where he wants to go in life. He knows who he is as far as character goes. And it doesn't matter what anybody else says. This is who he is and this is what he's doing.
I have several goals. My first one is to get a scholarship to go to UCLA and play basketball.
What other goals do you have after UCLA?
To make the NBA.
Who do you want to play for?
The Thunder.
We honestly feel like you can throw anything at the 4 of us, and as long as it's the 4 of us, we can handle it.
My life is perfect. It really is. I wouldn't change a thing. Like this past weekend, I went and watched a basketball tournament. And a few days before that, I watched my daughter go to gymnastics. And right now they're doing PSSAs and straight A students. I get to go to work every day with my wife. It's perfect. Yeah, it's amazing.
Are you thankful for being, for mom and dad and?
Mm-hmm. I'm happy I'm still alive.
How happy?
Very happy.